Welcome to Mayo Medical Laboratories Hot Topics. These presentations provide short discussion of current topics and may be helpful to you in your practice. Our speaker for this program is Dr. Piero Rinaldo, co-director of the Biochemical Genetics Laboratory, professor of laboratory medicine and pathology, and T. Denny Sanford, professor of pediatrics at Mayo Clinic. Dr. Rinaldo has recorded this 6-part series to introduce you to the R4S Collaborative Project, demonstrate the various tools, and introduce the concept of disease ranges versus reference ranges for more accurate identification of abnormal values.
Thank you for the introduction. This presentation is the first portion, Part A, of a 4th segment of a series describing the products and clinical tools of a newborn screening quality improvement project called Region 4 Stork, or R4S. The title of this presentation is High Throughput Data Entry Portals. During editing, this topic has been divided in 2 portions to remain within the required time limits of this type of presentation. I have a disclosure to make. A provisional patent application related to some of the content of this presentation has been submitted by Mayo Clinic. The title of the presentation is Computer-Based Dynamic Data Analysis. This presentation continues the overview of the 2nd generation of R4S tools, this time focusing on how to use them effectively in a daily laboratory practice where convenient uploading and rapid large-scale data analysis are highly desirable. In the previous segment, Part 3 of this series, the tool builder and the 2 most commonly used tools, the one-condition tool and the dual scatter plot, were introduced. Although it was described how these tools are produced using the tool builder, there was no information about their use in a laboratory setting. It was done this way to underscore their clinical utility to a user rather than a producer of laboratory results. Indeed, the one-condition tool and the dual scatter plot can be described as the clinician's tool, tools that can be clinically useful literally at the bedside of a patient after laboratory results have been interpreted and reported. In this segment, the focus is instead on the laboratory tools, the tool runner and the all conditions tool. We begin with the tool runner. This tool allows the simultaneous evaluation of all conditions with an active tool for multiple patients in any number from a few to thousands, typically one 96 well plate at a time. What is a tool runner? The tool runner is a portal to upload to the R4S website all batches of raw data after conversion to a CSV or comma-separated value file. This type of file can be generated routinely and automatically by virtually any operating system of commercially available tandem mass spectrometers and also most types of laboratory instrumentation. The tool calculates automatically every possible score for each case in a batch using all released one-condition tool or a smaller user-selected panel. The tool runner generates a report of all instances with a score greater than the first percentile of the scores of all cases with a given condition. In other words, a score within the range of values obtained for the populations of true positive cases. This slide summarizes the process from raw data to an actionable report. The instrument software generates a CSV file. The file is uploaded to the tool runner on the R4S website. All one-condition tools are run simultaneously, and the summary reports of informative scores is produced. To emphasize the user-friendly nature of this process, we call it click, click, done. The apparent simplicity of this process from the viewpoint of an average user is quite a contrast to the underlying complexity and magnitude of the data being analyzed. A typical 96 well plate includes approximately 90 patient samples, depending on the number of controls added to each plate, in this case 5, the first 3 and the last 2 wells shown as blue circles. The total number of analyzed results and calculated ratios for a plate is also variable, but in most cases exceed 100. All things considered, a single plate analyzed for amino acid and acylcarnitines by tandem mass spectrometry routinely generates more than 10,000 results. The magnification of a small portion of a spreadsheet allows a better understanding of a raw data structure. In this instrument-generated spreadsheet, one patient per row, the following elements are included. The overall file name of a batch. Please note the file type .wiff is a file format of one type of commercial instruments in use in our laboratory. Other common types are, for example, .raw and .d. The sequence number, here called the sample index. The specimen ID number that is assigned by the main laboratory information system. The last name of a patient, not shown here for obvious reasons. The sample type, unknown, indicates a routine first specimen. And finally, the analyte abbreviated names and actual results. Two of these elements, the specimen ID and the patient name, are considered patient health information, or PHI, and as such are not suitable to uploading to a web-based application, even if password protected, like R4S. For this reason, instrument softwares can be programmed to generate a different type of file using the CSV file format. As a reminder, a comma-separated value file stores data in a plain text form. Plain text means that the file is a sequence of characters separated by a literal comma or a tab. As ratios are calculated by the R4S tools, only analyte values need to be included, reducing the cumulative number of results to less than half of the original file. Again, magnification of a small portion of the spreadsheet allows a better understanding of a raw data structure. The data elements of a CSV file are the following: the analyte abbreviated name, the sequence number, the analyte results, and a very important new element, the LOINC code. LOINC stands for Logical Observation Identifiers Names and Codes, which is a universal code system for identifying laboratory and clinical observations. As stated on the home page of a website maintained by the Regenstrief Institute at the University of Indiana, LOINC has standardized terms for all kinds of observations and measurements that enable exchange and aggregation of electronic health data from many independent systems. A LOINC code is unique to a combination of component, system, which is sample type, scale, and unit of measurement. More information on the application of LOINC codes in newborn screening can be found in this publication. Going back to the CSV file, the final output is void of any PHI. Individual cases are identified only by their sequence number in the batch, an information that cannot be traced back to a specific patient. When ready, the CSV file needs to be uploaded to the data entry portal of a tool runner, as user needs to log in on the R4S website, access the post-analytical tools page, and click the tool runner link. The selection page of a tool runner consists of three sections. They are, from top to bottom, select a tool, tool selected to run, and select data files. Not all functionalities are accessible to all users. For example, the option to select a not yet released tool for testing and validation purposes is limited to those users who have been granted access to the tool builder. The remaining options in this section are relevant to a situation where a user is interested to run a subset of tools instead of the default action, which is to run all of them together. If, for example, a Minnesota user wants to run a single tool created to identify MCAD carriers, he or she would first select fatty acid oxidation as condition type, then select the desired condition, tool type, and tool version from the drop-down menu. By clicking the Add icon, the chosen tool is activated in the next section. In the next section, Tools Selected to Run, the opposite action can be taken, which is to remove one or more of the previously added tools. To continue using the customized subset, the user must select Run Selected Tools instead of a default Run All Single Tools. Two additional functionalities are available. One is to include in the report all the scores greater than 0, but still below the selected threshold of clinical significance. The other is to convert the standard report into an unprotected Excel file ready to be saved on the user's computer. In the third and final section, Select Data File, users have the options to select either the file format compatible with derivatized profiles, shown as D within square brackets, or the alternative format that works with underivatized profiles, shown as U within square brackets. The correct format should be selected and displayed automatically if a user with read and write access from the same site had answered the series of questions in the Data Submission Participant Profile menu. If a choice was made in this window, the format is adjusted accordingly in the tool runner. If an answer had not been provided yet, the default format is D. A user of an underivatized method from a site with an incomplete profile would not be prevented from using the tool runner, but an error message would appear explaining the incorrect line codes were submitted for some analytes. When the display shows the No File Chosen message, the uploading of a batch file is quick and easy once users have created on their computer desktop a shortcut to the server location where the instrument-generated files are stored. A click on the link brings on subfolders by year, by month, and by day. Each subfolder corresponds to a 96 well plate, and it includes the CSV file ready to be uploaded to the tool runner. Another seldom needed feature is the option to eliminate from the calculation of scores additional wells of the 96 well plate in addition to the first 3 and the last 2, which are used for quality control purposes. Again, many of these features are included to provide the greatest possible flexibility to meet diverse needs of a diverse number of users. But in reality, the processing of a batch should not take more than a few seconds to access the tool runner. Select a file and click Run Tools. After clicking the Run Tools icons, a report is generated in just a few seconds. The header shows how many profiles were processed, 91, and how many scores were calculated, 3,731. The CSV file name and the batch ID of the original instrument-generated file are also included to facilitate tracking. Before discussing the report in more details, it is important to explain how the system is designed to react to incomplete data sets in order to prevent the incorrect assumption that a condition tool was not informative because of one or more results were actually missing. In this instance, everything was in place, so no alert message was displayed to the user. On the other hand, the uploading of the same file after a single value had been removed randomly, in this example just the numerical result of the acylcarnitine C51 in row 23, triggers a report with a clear indication of the underlying problem. The header now includes a new descriptive element, the not run count, and a table listing the specific tools that were inactive. If a C value is removed from all rows, the error message is phrased accordingly, with the addition of a note reminding the user that any inactive tool could be modified to be site-specific and not inclusive of a missing analyte. As a reminder, tool customization will be the main topic of the next presentation. Going back to the report, when the system is set up properly, truly all that it takes to generate a report is 3 clicks of the mouse. The report shows that out of the initial 91 cases, there were only 3 with informative scores. The first one, sequence ID 26, triggered a score for the VLCAT carrier tool, but not for true VLCAT. For this reason, this finding could be discarded without further evaluation. The VLCAT carrier tool is site-specific. Only Minnesota users can see it. Indeed, it is not available to all users because it generates a score frequently and could have the opposite effect of the real goal of a tool runner, which is to limit the number of unnecessary referrals. The second case, sequence ID 61, indicates multiple amino acid elevations that fit the pattern of total parenteral nutrition. In our experience, this result is sufficient to classify it for what it is, a nutritional artifact of no clinical significance that requires no referral to follow up and not even the collection of a repeat sample. In this batch, there is a single case that requires closer evaluation, the patient with sequence ID number 84. The tool runner report shows an informative score for 3 conditions: VLCAT deficiency, 3-hydroxy-acyl-CoA dehydrogenase deficiency combined with trifunctional protein deficiency, shown as LCHAD/TFP. From this point forward, these conditions will be described simply as LCHAD, and again VLCAT carrier status. Selection of a blue link for VLCAT brings up the data entry window with all the results fields already populated. Clicking the Calculate icon at the bottom of the window produces the one condition tool for VLCAT deficiency. This slide shows the connection between the content of the tool runner report and the elements included in the score report of the one condition tool. The 3 elements that cross over are the actual score, calculated against the entire population of true positive cases, and the percentile rank among those cases. The third element comes from the interpretation guidelines, and that is the interpretation group score 30 to 50 that includes the calculated score 45. It is worthwhile to show a quick reminder of the methodology used to define the interpretation groups in a consistent and objective manner. In the tool builder, the verification of a new tool before release into production is based on 2 steps called impact and run. In the first one, the testing of different rules generates a report called condition score ranges. The green background signifies that the rules did have a positive impact on the scoring. The interpretation guidelines of all R4S tools are based on 3 percentile values: the 1st, the 10th, and the 25th percentile of a condition score range. For consistency, all threshold values are rounded to the nearest multiple of 5. A score below the 1st percentile, in this case a score less than 30, is considered not informative and therefore will not be included in the tool runner report unless the user activates the option to see not informative scores. A score between the 1st and the 10th percentile, or between 28 and 51, rounded to 30 and 50 respectively, is considered informative with a textual representation of being possibly indicative of VLCAT deficiency. As the score goes higher, between the 10th and the 25th percentile, it is represented as likely indicative of VLCAT deficiency. Finally, a score greater than the 25th percentile is very likely to be consistent with a biochemical diagnosis of VLCAT deficiency. No additional categories are deemed necessary, as scores above the 25th percentile should be increasingly self-evident, even when using the most conservative cutoff values. The tool builder allows the inclusion of a header that could be used for disclaimers. In the newborn screening tools, this option is used to warn users that R4S tools have been validated only for neonatal blood spots collected before 10 days of age. Going back to case number 84, the slide shows the 3 tools with informative scores. This outcome is far from being indicative that further action is required. Instead, it should be framed like a differential diagnosis between VLCAT and VLCAT carrier and a verification that the score for LCHAD deficiency, barely above the first percentile, is indeed sufficiently significant to warrant a referral to follow-up. As discussed extensively in the previous segments of this series, the degree of overlap between reference and disease ranges is the conceptual foundation of a post-analytical tools. In LCHAT deficiency, most of the informative markers, namely C16 and C18 hydroxy long chain species and related ratios, are present under normal circumstances at very low level. Many participating sites have listed a zero value for their first and 10th cumulative reference percentiles, a situation that translates in the peculiar behavior represented in the plot by condition, especially at the low end. Using the skewed reference ranges, the scales yields a score barely above a threshold. Not all sites are affected by this problem, and indeed Minnesota is not one of them. In a case with a borderline score for LCHAT deficiency, Minnesota users are trained to switch to our own percentiles, a change achieved by a single click in the data entry window. The impact of this customization is shown here. The overlap between the reference and disease ranges of these analytes is reduced significantly. The calculated score, 6, is now well below the first percentile of the LCHAT score range, and therefore can be interpreted with confidence to be a non-informative, in other words, normal, result. This simple process allows the exclusion of LCHAT deficiency, leaving unresolved only the differential diagnosis between VLCAT deficiency and VLCAT carrier status. As shown in the previous segment, this can be promptly achieved by switching to the dual scatter plot. The plot places convincingly this case within the VLCAT carrier cluster. In summary, the post-analytical interpretation of the results of a 96 well-played, 91 patients can be finalized in less than 1 minute of work by a user trained to navigate the R4S website and the tools we're in. The process is rapid, paperless, and most importantly, it provides a mechanism to maintain consistency among different users who may have vastly different expertise, from just a few months to years, if not decades, of experience. To recapitulate the clinical utility of this functionality, the tool runner allows the simultaneous analysis of large batches of newborn screening data. While testing of one plate at a time is a logical approach in a routine situation, a CSV file where the data of 96 well plates were merged for testing purposes have been analyzed successfully. A database of approximately 60,000 cases has been processed after the selection of a single one-condition tool. As a reminder, the tool runner calculates a score with every available one-condition tool and generates a summary report of all informative scores. On the other hand, it can be applied to either a single tool or to any desired combination of general and/or site-specific tools. In our experience, it is not uncommon to see reports like this one, where an entire plate could be resulted as negative when not a single one of the calculated 4,095 scores was informative. With the understanding that some users might not be completely comfortable with this type of outcome, it is possible to expand the report to include all scores that were anywhere above 0 but still below the threshold of clinical significance. Finally, the report of a tool runner can also be exported to Excel for documentation, research, quality assurance, and system evaluation purposes. Since the launch into production of a tool runner, a frequently asked question has been, is anybody beside Minnesota using it? That is a legitimate question that we're glad to answer. The tool runner became available to R4S users in November 2011 after being presented to the final R4S user meeting in San Diego. This activity was made possible by the HRSA Regional Collaborative Grant that ended its second cycle in May 2012. It was utilized 79 times in December 2011 by Minnesota and 2 other programs. In 2012, however, the tool runner was deployed more than 6,000 times. 700,000 profiles were tested and almost 70 million scores were calculated. In the first 2 months of 2013, more than 5 million scores have been calculated, an 80% increase when expressed as average utilization per month. To date, the tool runner is used regularly by 21 programs. The majority of them are located outside of the United States. This is a conclusion of the first portion, Part A, of the fourth presentation of the R4S series. In the second portion, Part B, the second type of high-throughput data portal, the all condition tool, will be presented. Please do not hesitate to contact us if you have any questions or requests related to the content of this presentation. Thank you very much for your attention.